So today we're going to use resistance loops or bands to help Shelby here improve her sciatica. So what we want to do is develop a workout or a routine with these bands that are going to improve the environment in which the nerve lives and not increase her discomfort or aggravate her, but also improve her core strength and lower back strength and hip strength at the exact same time. And so as a doctor of physical therapy, I do this with my clients nearly every day, and this is going to be an effective and safe workout using these bands to help improve and nourish the sciatic nerve. Okay, so we're going to start off using these bands. These bands, I'll put a link in the description. What I love about these is that they're cloth and they provide some resistance without being too thick. And they have no rubber on the inside, so they're not going to pull your hair. They're just really solid bands. And so I'll put the link in the video description. But Shelby, which one would you like? Would you like medium resistance? Would you like low resistance?
Let's go medium.
Medium?
Yeah.
She's in for a challenge today. I love that. Okay, so go ahead and lie on your back. We'll do a medium resistance here. There we go. Let's do this one. Middle of the road. Okay, so we're going to start off on your back, and so either get on the floor, yoga mat, or use a table if you have one. Your bed would be okay, but we're going to start off with our first exercise here. So go ahead and bend your knees. We're going to put this band around your knees, and we're going to do, you'll notice consistency throughout the video between 12 and 15 reps. That's been shown to not only improve strength, but muscle size as well. So that's what we're going to shoot for. Her first one here is going to be a bridge, so everybody knows this. When you're dealing with sciatica and you're strengthening at the same time, what we don't want is an increase in nerve pain or back pain. So you have two options. Option 1B is if you're feeling the discomfort during the exercise, either reduce your range of motion or take a break if you need to. And if you're going to take a break, the second option would be to do your favorite stretch or whatever gives you relief. And so if Shelby has any of that during this video, we will address it. But if you're doing this at home, we're going to do the exact reps that I would do with a patient that is wanting to improve their sciatica and strength at the same time. But if they have any increase in discomfort, we would manipulate or modify if we needed to. So she's going to start off with the first exercise being a bridge. And so she's going to lift her hips up and then the bridge with the hip abduction. So she's going to go in and out with her hips. She's going to maintain that lift and in and out. So let's do 12 repetitions while we're up there. And we'll do 12 with, you don't have to lift the whole time. Yep. Stay up there, 12 reps in and out. So she's going to think about contracting her butt and think about lifting her hips and keeping her glutes tight while activating the outer hips. And the great news is these outer hips, that's where the sciatic nerve lives. And so a lot of people prefer to be an extension. We're going to extend the hips and back and do the 12 repetitions with the bridge here. How's it feeling?
Perfect.
It should be a good burn, right? And so she's going to do another set here because we're going to do 2 sets of everything because that's exactly what we would do. Exercise and doing this type of movement for sciatica and strength is just like medication. You have to dose it appropriately to have change. If you underdose yourself, you're not going to have the change that you're looking for. So we're going to do 2 sets of 12 because that's exactly what I would do with somebody if they have sciatica. So she's going to maintain great form, which she is here, and then we're going to use this band to help provide that extra little resistance. Is it comfortable? Mm-hmm. Perfect. And now we're going to level her up a little bit. We're going to straighten this leg. You can keep this leg on the table or lift it in the air if you want that little extra. Let's lift it in the air for a couple reps here, and then she's going to lift up and then use her right butt here to help lift her up and go back down. And she's going to go up and down, maintaining that same rhythm and form, thinking about contracting her glutes. 12 repetitions again on this side. This is where you might see Shelby sweat a little bit. This is a hard exercise. It is safe and effective for back pain and sciatica though. She's going to think about keeping her core tight and lifting up and keeping the glute nice and contracted. So the great news is it's a one-legged exercise. So while it's hard, when she has to do her other side, the right side will get a little bit of a break. So don't feel too bad for her here. Good?
Again?
No, left side now. Yep. So she's gonna do the left side for 12 reps here. And then these are the only 2 we're gonna do lying down. We're going to finish off with some standing ones here because we want to do some different movements in different positions. Great. And so if she was a patient of mine, and let's say she's doing this and she has a little bit of tingling, well, what I would do is tell her to rest, and then she would do her favorite exercise or stretch to reduce that tingling, whether it be a nerve glide, which I've done plenty of those in past videos, or a prayer stretch, or something that she would use to give herself some relief. Having some discomfort or tingling isn't telling you to stop exercising and get out of it and never do it again. It's just saying listen to your body, and then we're going to adapt as we go. So now for our next exercises, I'm going to have Shelby stand up. We're going to do some great strengthening with this band that's safe for your sciatic nerve. So now we're going to finish off with our 3 standing exercises. And so we're going going to continue focusing on lower back and glutes and help protecting the sciatic nerve, but again, giving yourself that little boost in strength. So Shelby here is going to put this around her knees. If she put it around her ankles, it would be harder. So just kind of judge your strength and where you're at. Let's just go right above the knees. That's perfect. Okay, go ahead and turn around for us. And then what you see on her leg is where I drew the sciatic nerve, right? Just as a reference so we could, if we needed to use that. But she's gonna be in a sport-ready position. Good, that's perfect. Sticking your butt out a little bit, which you're doing great, and that engages the lower back and hips, which the sciatic nerve lives. And then she is going to take small steps, maintaining tension in that band, over towards me, and then she's gonna go back the other way. We're gonna do about 20 repetitions here. And since she's fighting gravity, being standing up, we're strengthening the lower back and the hips at the same time. I'm all about being efficient and effective. And so how do we do the most amount of strengthening and nourishing of the nerve as we can without spending 15, 20, 60 minutes doing exercise? And so this is what I would do. 20 reps is recommended, but honestly, if you could do more, just go till you feel the really good burn in your hips. It's going to be good for you. How you feeling, Shelby?
Good.
Good. So she should feel a good burn in her hips. Again, we would do 2 sets of this. So I tell my patients, just shake it out a little bit, let those glutes calm down, and then she's going to be in a sport-ready position again, and then go back into it. And so if I saw that she was super successful and not feeling a burn, I would just have her move the band down to her ankles. And since this is a cloth band, it doesn't roll up on you, it doesn't pull your skin. It's just really, really good. Should be comfortable, right?
Nice.
Comfortable as in strengthening, but like it's not hurting you. Perfect. Feel good?
Yeah.
Okay, so she's gonna maintain that band. You could turn around now. She's gonna maintain that band in the same position. She's gonna spread her feet. She's gonna think about pushing out with her knees a little bit and then go down into a squat. Perfect. Ooh, she's going deep. I love it. A good deep squat, which is good. She's gonna maintain tension in that band. And what that's doing is it's activating all of the hip musculature and lower back musculature that's associated with the sciatic nerve. A lot of my patients don't have tingling or pain with this, but it's just hard. And if she had any discomfort, I would just tell her to reduce her range of motion and not go down quite as deep into the squat. If she was feeling great, then we're just gonna do two sets of 12, right? That good 12 number, which is good for strength and hypertrophy. She's killing it here.
One set?
Yeah, 1 set is good. And then we're gonna move on to the second set, which is perfect. So she should be feeling a good quad work, good glute work, lower back work. And these are just foundational exercises to help improve the environment in which the nerve lives. But what's great is you can use these bands anywhere. You don't have to go to the gym, and you can still get a great workout that's safe and effective for your sciatic nerve.
10.
Good. She's loving it. Good.
12.
Perfect. So now we're going to move into the very last one, which she's going to use something to hold up with. So it's not a balance exercise, and we want to focus on encouraging the nerve to grow and the muscles to grow stronger. So she's going to turn around. She's going to grab this here. You could use the countertop or whatever you want to use. Stand on one leg, and then she's going to focus on sticking that hip out and that leg out.
Awesome.
So this moves a little bit, so just be careful. Good. Yes, and so what she wants to focus on is feeling it into her glute. This is where she should be feeling it. And you're gonna feel your lower back tighten up as well. We're fighting gravity, but this is where we wanna feel that good burn. Again, if you wanna make it harder, you put it at your ankles. And again, that 12 number keeps coming back because we want to improve strength and size of the muscle. So we're going into the glute. You feel it in your glute?
Yeah. 10.
Should feel good. And what's sneaky about this one is that the leg she's standing on is working really hard too. She should feel that that leg she's standing on has a good burn into it. Feel it?
Yeah, I switched sides. Is that okay?
Yeah, that's perfect. Yep. So now she's getting a good hip activation on the other side. And so your hips and your quads and your lower back, you're going to feel like you did something, but it's absolutely safe for you. Again, if you feel any of your discomfort, go to your go-to stretch during this, but don't give up on the reps and sets because this amount has been shown to improve strength. And if you do this 2 to 3 times a week over a month period, you're going to notice that it's going to become easier and you're going to build some strength.
Perfect. 2 sets?
2 sets, like everything else. 2 sets. And so Shelby is regretting agreeing to doing this right now. But what's great is that she's going to be working on her hip strength. And this is the exact thing that I would do with a patient if we're like, hey, let's use these loop bands to challenge the system, improve the environment in which the nerve lives, and help give you some strength to help improve walking or whatever your day throws at you. And so she's gonna finish off here. And so if I was working with her, I would tell her we're gonna finish off this. We're gonna do a little stretch afterwards. And then I'm going to do some manipulation and just improve it. But if you guys have any questions about these exercises or how to modify, make sure you put those underneath the description of the video. I will get back to you. I think it's important to get those questions answered because everybody's body is a little bit different. And I'm not right there to give you some of that feedback. So if you have any questions, please ask. But I hope you guys enjoyed this video. And this is a great, safe, and effective workout with a looped band and when you're trying to address back pain or sciatica. And as always, stay healthy, keep moving, and take care of yourself.